On to our main story, the health system. So the way Aotearoa New Zealand, that now seems to be the accepted usage or name for our country, is structured, and the way that health services are delivered is changing. Apparently, the public health and disability system has significant and ongoing issues in delivering equity and consistency for everyone. And we all know that demand for health services will apparently keep growing due to our ageing population, advances in care, and many more people having chronic long-term health conditions. And apparently the changes that Labor have announced, the Labor government's announced, are being made to meet those future challenges and to make sure all New Zealanders get the health services they need. Well, will they? Do they have a snowball's chance in hell of achieving that? Well, to ask that question, we're joined by Emeritus Professor Des Gorman. Des, good morning to you. Thanks for joining us again on the platform.
Oh, you're welcome, Sean. Good to see you again.
All right. DHB's gone. Centralised. Firstly, just look at that as that structural change. Do you think this is a good thing? Do you think that alone delivers benefits to New Zealanders?
No, I don't, Sean, but then I'm a sceptic about change that's largely structural. The idea that you can restructure the health system and expect an outbreak of better health care, I think is magical thinking. Unless you go about a reform with some clarity about the change in health experience you want to enable, to expect shifting the bureaucrats around is going to make any difference to access to and the outcome of frontline services, as I say, is magical thinking.
But surely the government could say, look how much better our health system runs. Isn't that a great thing?
Our health system has been quite sustainable over the last 80-odd years, Sean, but it's not stable, and it's got inequity baked in. No matter what sort of reform's been attempted since 1938, the inequities remained. And there's nothing about this reform that's going to fundamentally address those inequities. I know that Minister Little talks about the postcode lottery and how that what he's going to do is going to materially affect the postcode lottery. So we're going to get rid of 20 DHBs. We're going to create 60 to 80 localities instead. We're going to have 4 regional centres. We're going to have a central bureaucracy. The only thing you can guarantee from that is that there's going to be a significant increase in the size of the bureaucracy. Yes, we've got rid of 20 DHBs, but we're replacing them with 60 to 80 localities. We're not sure where those localities are yet or what they're actually going to be doing. And in terms of the postcode lottery, it's a lot more complicated than that. The inequity depends upon who you are, where you are, and what you need, want, or expect. And to a very large extent, Sean, the inequities are underpinned by lack of resourcing and lack of personnel. It's a workforce issue. For example, if you live in Northland, if you live in Kaikoai and you need psychological care, there are no psychologists available. If you live in Gisborne and you have a demanding cardiological problem, not Gisborne, if you live in Wairau and you have a demanding cardiological problem, there are no cardiologists available. So how restructuring the central bureaucracy is going to change the availability of services in regional, rural areas or to underprivileged areas, I say, it's just magical thinking.
But we're going to have, for some would say the most underprivileged or the group that gets the least out of the health system, we're going to have a whole new Māori health authority to take care of them.
Yeah. Well, look, I feel very much for Māori health. I mean, I'm given my own whakapapa, Māori health is something I take very seriously. I don't believe the Māori Health Authority will materially change healthcare.
Why not?
For Māori. Well, I think it would allow... Well, so first of all, where are the competent practitioners going to come from to staff a commissioning, purchasing and funding agency? Secondly, how on earth are these two funding agencies going to fund into the same system? There will be conflicts and they'll have to be resolved by the minister. But thirdly, and most importantly, Sean, these sorts of agencies have the potential, in fact, the likelihood that they'll allow an abrogation of responsibility for Māori health just to the Māori Health Unit. It's a bit like, Sean, some companies which have very good health and safety officer, a very good health and safety office, but they have dreadful health and safety performance because everyone else in the organisation thinks that's their responsibility, it's not mine. What we need for Maori Health centrally, excuse me, is an enabling agency, an agency that helps everybody in the health system address better access and better outcome for Maori. So my deep fear is that the Maori Health Authority will allow the system to abrogate its responsibility and will not realise that, in fact, every single one of us in the health system have that responsibility.
I guess that comes to the issue, are Māori doing worse in health statistics because they are Māori, purely by virtue of, if you like, their ethnicity or their whakapapa? Or can we look at everyone doing poorly or receiving worse service in the health system and say that no matter what the colour of your skin or your heritage, it is where you live and your socio-economic status that will decide whether or not you're getting the most out of the health system?
Look, I think that the problem with statistics, like looking at are Maori doing worse in health than other races, the answer is yes, they are, much worse. But is that explained simply by their genetics, or is it explained by, as you say, their complex interplay of social circumstance, income, education, and so on? And I think the answer is the latter. It's disease, health inequalities are socially determined, Sean, and I remember there was this wonderful paper written by a guy called Michael Marmot in 2006, where he described that the paper was called The Social Determinants of Health Inequalities. And what Michael did in the title of that paper, he identified the problem, but he also identified the solution, the social determinants. If you want to materially change mental health for Māori in Northland, for example, the investment should be in education, housing and employment. That's where the education needs to be, because that disease is socially determined. So I think you're right. Does being genetically Maori mean you're going to be worse off from a health perspective? I don't believe so. But I think that complex interplay of social circumstance, education, housing, employment, and also dislocation from health services, it's a far more complex thing than the minister's getting on about, which he says it's a postcode lottery. Look, he's right statistically, but from a ideological point of view, that's a very, if you like, superficial view of the problem.
Mm. I would like, perhaps naively, to think that this new plan for health is based on some piece of academic research, a consensus worldwide on how to build better public health systems, that there's a grand plan here and we can look to some expert who's come up with it. Is that what has driven this? Has anyone else done anything like this anywhere in the world? Is there precedent for this working?
Well, we've done this. I mean, we did this with the Health Funding Authority.
Yeah.
We've been down this path before. Graham Scott, who was a former Secretary of the Treasury, was the last chairman of the Health Funding Authority, which was disestablished by the last Labor government to create the district health boards. So what we're seeing now is this Labor government reversing the reforms of the last Labor government. I think these reforms are driven ideologically, they're not driven scientifically, and certainly they don't conform to best practice. Best practice change by design, as you know, for a service industry, is entirely driven by understanding who all your users are and what their requirements are and addressing those directly. That's not the way this has been done. This is an ideological centralisation of command and control and the expectation that somehow this will lead to an outbreak of better health experiences, which is why I describe it as magical thinking.
Okay, in other words, fantasists. That's yes. Another word for magical. Well, this is people are having a fantasy moment here, the government.
Well, I mean, what would make you think this will work any better than last time we tried it, and the time before that, and the time before that? I mean, what's happening in most health jurisdictions, Sean, is that the central agencies are there to empower, facilitate, provide a resource centre, provide a clearinghouse of good ideas, but you're looking for local solutions for local need. Mm. Now, I assume that's the point of the localities, but I just want you to think about that. We're going to have 60 to 80 localities. So if I'm a general practitioner beavering away on my practice, I might belong to a practice association. I probably still will have some support from from my primary health organisation. Then there's all these localities, and there's regional coordinating centres, and then there's this new central agency. You know what I'm going to do, Sean? I'm going to ignore the buggers, all of them. I'm going to get on with my job the way I've always done it, and I'm going to hope that they interfere with my life as little as possible. So I suspect that for the citizens of New Zealand, they won't notice any change in their access to healthcare. And the people with good access will continue to have good access, and the people with bad access will continue to have bad access.
I guess that's the other point I'd like to ask you. Surely the proof of a pudding like this is in the eating. Do you see a way to measure the success of these reforms in real terms? And have they set any targets or goals in terms of service delivery to New Zealanders that would allow us to assess the success or otherwise of these, as you call them, ideological reforms?
Oh, look, I think that's a very important question. And yes, they have. There is an outcome matrix that is produced. And Murray Horn and I have published a paper explaining why those measures that they've introduced are extraordinarily weak. And not only are they extraordinarily weak, they largely miss the point. Yes, all health systems should be accountable, and they've got to be accountable for valuable outcomes. For example, if you're measuring the outcome of cataract surgery, the outcome that's valuable would be the old person getting their licence back. If you're looking at the outcome for mental health intervention, the outcome you want to know is that the person's participating in society again and living independently. There's none of those measures. They continue to look at very short-term activity-type measures which simply measure activity. They don't measure outcome. The two most disappointing things about this health reform is they've learnt nothing from decades of health reforms in New Zealand, let alone decades of health reform internationally. And the second most disappointing thing is that the accountability measures, they look to me as though they'd forgotten to do them, and then thought, oh, bugger, we need some accountability measures. And so they rushed them off at the 11th hour. They don't look like a carefully planned set. But, Sean, if you don't begin with the customer experience you want to enable, if you have no clarity around that, you can't possibly have clarity around how you're going to measure that as an outcome.
Right. Hundreds and hundreds of millions, if not billions of dollars have been committed to this policy for years ahead, and I've heard some suggest that it's Labor just trying to suck up and commit all the money that a new government of a different hue might want to spend in the future. Given that, and looking at the changes that are now underway, could you roll this back? Could you alter it? Could you turn this Titanic, which you, I think, have basically said is going to hit an iceberg at some stage, or at least not get to New York in record time? Can you turn around or alter these reforms? Could an incoming government of a different hue do better?
The answer has to be yes, because it's hard to imagine a less focused set of reforms than these. And so I think an incoming government would have to look at how it changes its entire culture to being a service industry and understanding who it serves and what they want. I think there's going to need to be, in the short term, Sean, a shift of resources from the back office to the front office to deal with the backlog of disease which existed before COVID and has got a lot worse since COVID. And at the same time, there's going to need to be two, I think, strategic developments. One of those is social commissioning. That's the idea that Bill English championed, but Murray Horn and I presented that in 2014 when we wrote our health funding review. I mean, given that health is socially determined and given that health has broad social impact, it stands to reason that you need to have a social commissioning approach, because most of the things...
Oh, I think we've lost him. And that just happened. That's all right. Des has dropped off the end of the world. We might get him back later. But I want to review what he says. He says these are ideological health changes. He says it looks like they made up, if you like, the success measures after they'd done it all. He believes it can be turned around and it will largely simply result and an increase in bureaucracy, an increase in payment on bureaucracy. And Des Gorman hasn't got skin in the game. He calls it like he sees it. He is an emeritus professor of medicine, has been on a Prime Ministerial experts group, which is actually the last thing I wanted to ask him. But what do you think of what Des Gorman had to say? These massive health reforms, Labor reversing a policy it itself introduced and largely ideologically driven. I am not full of optimism about the health reforms at all.